Now, the COVID pandemic has claimed more than 1.6 million lives worldwide and has completely disrupted our lives in 2020. Nothing will bring back the loved ones who we have lost and those who have left us. But it will be a shame if we don't learn our lessons and make changes now to make our healthcare system even stronger. If anything, COVID pandemic has hastened the adoption of e-health concepts and solutions which we have always underestimated, saying that their time had not come yet. The healthcare ecosystem in our country is being reshaped as we speak, where e-health and digital systems are helping to increase the availability of health services in remote areas in a no-touch fashion, sometimes by public and private partnerships, reducing the dependence on physical infrastructure, which is sometimes stretched in a safe environment. What strides have we made in delivering e-health in our country? How is the current infrastructure being used to deliver the care? With the government already working on the digital health mission, will public-private sector come together to improve access to healthcare and turn the system on its head to emphasize prevention over treatment? In this session, we are going to discuss strengthening the digital backbone of healthcare for high on tech health for all. We have an eminent panel of experts joining us. Please welcome Dr. Geetha Manjunath, founder and CEO of Niramai, Dr. Dhaval Shah, co-founder, PharmEasy, Kunal Kapoor, actor and co-founder of keto.org. We have Alok Awasthi, founder of SeekMed. We have Chander Sibal, Senior Vice President, Medical Division, Fujifilm, joining us. And we have Sourabh Agrawal, Vice President, Sales and Marketing, Lupin, India, joining us. A warm welcome to all of you for joining us on this very important panel discussion on how technology is changing our lives in a good way, even after what we've been going through in 2020. So let me come to each one of you and try to understand how your product is giving us solutions that we couldn't dream of earlier. Mr. Awasthi, let me start with you. Now, telemedicine is not exactly new. These were things we were talking of even earlier. What has changed in 2020? Can you tell us what is the product you have and how it has changed now versus what it was earlier?
Yeah, thanks, Anisha, for the introduction and for the opportunity. So before we talk about the solution, let's first understand the problem. Healthcare challenges in India, or for that matter in any developing country, revolve around affordability, accessibility, and quality care. And let me add one more challenge, which is around information. Now, with smartphones and internet, we have a lot of information available, but many times patients find it difficult to get the credible information. And since healthcare is such a personal matter, it deals with people's lives. So building trust takes time. So strengthening digital backbone, to me, fundamentally is about gaining that trust with the help of technology. So at SeekMed, when the COVID crisis hit, we were ready with our telemedicine platform. It is a platform that brings the best in technology and the best in medicine together. We have some of the best doctors from India, award-winning doctors. So our platform connects patients from India as well as outside with our top doctors through telemedicine. And we recently also launched a health library, which we call as India's largest health library, focusing on patient education. So that when patients connect with those doctors, they learn about their diagnosis, they have better understanding of the treatment options, so that when they connect with the doctors in a limited time, that discussion, that interaction is fruitful, and we can get better outcomes from those interactions. At the same time, we also learned a lot of lessons. So technology leaders must look at those lessons, improve on the technology landscape, improve the business processes, and then basically build on opportunities that are in front of us.
All right. Thank you for your opening comments. Geetha ma'am, let me come to you. Now, we've held a lot of shows about cancer, and a lot of chronic care was put in the back burner because of COVID-19. But you still have to treat so many people. Now, What has COVID done to what you were offering? You were offering an easy way for women to, come to know or at least test for themselves whether they have cancer or not in the breast without going through a mammography. What changed? Did you find COVID being a disruption because people are not getting out of the house? What has changed in 2020 for you?
Yeah, thanks for that question, and it's great to be part of this celebrity panel here. Yeah, so before I say what changed, I'll just briefly talk about what we have done and what we continue to sort of evolve. I'm actually a computer scientist or entrepreneur, so with an inbuilt passion to solve this biggest problem in women's health, which is breast cancer. We started this startup called Niramai 3 years ago, where we've developed a completely new way of detecting breast cancer in a non-invasive, non-contact, and privacy-aware manner. That is, when we do this test, nobody ever sees or touches the person. And it's so important for breast screening that we have now actually gotten a lot of happy women coming in for screening, right? Instead of women who would do a mammogram and cry while going back because it's extremely painful and somebody sort of manhandled and so on, so right. So that is one element. Another bit is actually use of artificial intelligence, a technology-enabled solution to have an accurate solution for early detection of breast cancer in women of all age groups, because today's technology allows only for women above 45 years of age to get screened, and there are lots of women under 45 who are losing their lives to breast cancer without any test for detecting early stage, only hand, right? By accident, they figure out that there's a huge lump and then they go to a hospital and that's already stage 3, stage 4. And this is taking away more than 90,000 women in India alone, more than 650,000 women around the world. So that is what we want to solve. And then we developed this technology called thermalytics, which uses thermal imaging, just measuring the temperature, no radiation, and the artificial intelligence-led software that we have developed to have this completely automated solution for breast cancer screening. Of course, the report is reviewed by a radiologist to make sure that everything is well and clinical guidance is given. Now, come 2020, an unfortunate pandemic that we're all facing. One, as you rightly said, Anisha, people who are walking into a hospital reduced. And it's not that because of COVID, other diseases are going to sit back and sort of watch, right? I mean, these are continue to be there, right? In fact, hopefully every oncologist is now thinking sort of the number of people who have missed their cancer detection could be quite a few number. I don't have the numbers right away, but thousands of them have missed detecting their cancer because they missed the screening, right? And so at this stage, we said, okay, what else can we do? And our solution is radiation-free, which means that we can actually do it outside a hospital as well. And it's portable. It's a small device which you can put on your backpack and do. And we've done a lot of camps. So we launched this new initiative of home screening of breast health, which is the first ever time cancer screening is being done at home. And also women were actually more happy to get people, or rather the technicians come home. Of course, all COVID precautions are taken into account. And so that was a completely new launch of a service, home service that we did. Second thing we did was also to see, okay, we are experts as a team about thermal imaging and how to analyze this automatically. How can we use that to actually help control this big pandemic around, right? So using that and moving forward in that direction, we came up with a completely automated COVID screening technology. So this is about, there are lots of offices which were locked down and so on and so forth, right? So after that, it's opening up, a lot of people are coming in. And you have these security guards, trying to look at temperature screening, do that temperature screening using infrared thermometers. And it's a lot of error-prone manual procedure. And also it's very invasive. Whoever is going by, security has to catch it off and then do it and so on. So this whole thing is automated. It's a thermal camera and the software which watches every door into a building. And as and when people are walking in, we screen, we figure out who are people who are coffee, do a face detection, and then figure out what's the temperature of each person. We have a log of so many people who walked in, this is the temperature. And if somebody has a higher temperature, we actually signal, take an actual picture of the person and sort of, it can be tracked and, a separate care can be taken. In addition, we also do mask detection automatically, whether the person is wearing mask or not. And so we are enabling technology to, we are using technology to enable automated screening. It could be inside the offices, it can be in public places, and so on. Hopefully, that will help us contain. We also are able to do respiratory detection with computer vision based technologies. This is a lot of learning, and we hope we will be back to normal, if not close to normal. But technology can really help, in many such emergency situations.
Yes, that ma'am. Let's hope that the solutions that you're providing are going to be adapted, taken up more on scale as you move ahead, and more women will be able to get the screening done without being ashamed, without being scared, and proactively take their health in their hands. Mr. Sibal, could you tell us about your company? We all know Fujifilms. We think of Fujifilms and we think of a camera, we think of imaging. I'm sure you're doing a lot of other types of imaging in the medical field as well. 2020, how has that this year, changed things for you? What was the solution you had, and how has it changed now?
So 2020, as everybody knows, that it came with a very bad news of Corona, and everything stopped in the March, April, and May. These were the 3 months that we were completely locked down in our homes. So first thing we did was that to keep our employees motivated, we started with the training programs, sharpening the X kind of a program. So online programs for training them. Then our technicians, a lot of people. Definitely, we could not stop the services because we are into the COVID centers. We are having X-ray machines, CR systems, digitization, PACS, IT products, endoscopy products. So we have a lot of products which are going into hospitals. So wherever physical requirement was there, we were sending our people. But definitely, our online calls were much higher, and we were giving instructions to the biomedical engineers and other people to sort out those problems because there was a problem of even traveling. Public transport was also not available during that time. And also most of the radiologists actually also started to report from home. So the teleradiology services have taken a big thing because earlier there were no rules and regulations. So government has immediately found out, and they have given the rules and regulations. They've closed those things very fast, which were lingering on for years together. So those things were done immediately. Teleradiology, telereporting, and those kind of things, because as you know that the telehealth and other things also taken a lot of things, that there was a 10 times increase in those kind of things. So we have also started coming up with the new solutions, cloud-based solutions, which can be installed very fast with the radiologist. And we know that we have 40,000 machines installed every nook and corner of India, every village or every small places. We have X-ray machines, and X-ray machine is the first modality where any kind of a thing. So we are starting now to connect those things, those systems, and sending those images to the radiologist. Radiologist can report, and then on the mobile phone also, patient can show those images to his consultant. So these kind of things are underway, and we are going to launch it in a big way on a cloud. All these things will be on the cloud. So cloud packs and IT related services will be launched, and there are many things which is, as you rightly said, there is a lot of increase in digitization, which we were thinking we will do, how the systems will do it, who will pay for it. We were thinking a lot of things, but I think all of a sudden, those solutions we have got for those problems were there staring at our eyes, but we were not able to solve them at that point in time. But this has given us a kind of a crisis. Crisis has given us a kind of a strength to come up with a solution very fast. So, and many things are underway, like artificial intelligence. And we are now coming up our X-ray systems, or rather all the systems. The AI is inbuilt now, where after doing the X-ray, you can know the COVID score. What is the COVID score? And similarly for the mammograms, we can know whether the cancer is there or not, or it is a normal report. And then the report for the mass screening and those kind of application, NTB program. So in each and everything, endoscopy also, whether the cancer is there or early stage of the cancer is there. So these kind of things are there. Earlier also there, but now they are getting installed at many places and people are using them.
All right. So that's very heartening to hear, Dr. Sibal, how you've managed to scale up in time of a crisis. And increase your services in a digital fashion, in a telemedicine fashion. Saurabh, let me come to you. Now, as soon as the pandemic struck, the first thing that the pharma industry, braced itself was a cut of the supply chain. Your raw materials coming from China faced an outage. Thankfully, most of our pharma companies managed. We did not have a shortage of drugs. So, what is it that worked for pharma companies, and what are the solutions you're working for? Did you fix your supply chain in a fashion that you could predict these outages? Did you build new networks here? Are you using predictive analytics to figure out what drug will be needed more in the years to come and ensure that there'll never be a shortage? Could you tell us what Lupin has done, which is what it was not doing earlier after the 2020 crisis?
Sure. Thank you, Anisha, for asking this. I think along with doctors or healthcare professionals, I believe pharma has played a very vital role across in terms of servicing millions of patients and even doctors for making sure that there is appropriate addressal of this, COVID pandemic. In fact, until January, people were not sure what would be the scale of this entire pandemic. Well, there were early signals from China and rest of the world that it may spread, but probably India was not as prepared, and like always, we were thinking that we may not be as much impacted, and hence the preparation levels were really low. And come February end or March, I think this pandemic really created a huge impact, and then nation went into a lockdown towards the end of March. I would say that our industry and pharmaceutical in particular has not closed even for a day. I mean, I would say right from the day one, all our plants are working 24/7, making sure that all the essential drugs are manufactured and supplied in a seamless manner. I think support from initial, like I think what Sibal was mentioning about the fact that there were not even clarity on policies and what to do, what not to do. But very quickly, I think the system learned, and certain services like pharma or healthcare professionals or frontline workers were very quickly decided, and they were waived off from the entire lockdown. So that in a way helped us to make the logistics a little faster. However, we saw a lot of challenge because the truck drivers were not available. There are no people to lift the stock. So while we were able to manufacture at our plants at various facilities, like in India, we have 7-8 facility and where we manufacture our products, but we faced issue of labor shortage. Suddenly, people vanished, and I must commend people who are working in plants and all across, not just in our company but across the board, wherein many of these guys have gone out of the way to do the job which they were not entitled to. People have picked up stocks physically in their own vehicles, in their personal vehicles, to make sure that they are made available to hospitals and all. And then there was a huge partnership which happened between various pharmaceutical companies as well as the entire logistics providers to make sure that we don't do a disjointed work. Unlike in past, wherein a company would have its own dedicated, fully integrated supply chain, this was not the time wherein people had so much of liberty and luxury, because everyone was short in supply with laborers, everyone was short in supply with transporters, and therefore a couple of companies have come together to see how we can pull in the resource and start making the products move from factories to the mother godowns or depots, and from there move either through road transport or through air transport to various locations across the country. So that in one way, that collaboration between the companies has helped us to keep on top of the supply chain and make sure that products were made available. Another important thing that we realized that the adoption of various digital solutions were pretty slow pre-COVID, but just in 3 months we achieved what we never achieved in last decade. And thanks to a lot of innovation which have been done with people like I would say Alok, who have done fantastic work on teleconsultation platform, maybe the work which Dr. Geetha was talking about of advanced analytics and using machine learning and AI for better detection. And I think all of this become very handy to pharmaceutical industry as well, because we started providing some of these solutions to doctors. Finally, what happened is many of the healthcare professionals were short of many of these technology at their hand. But fortunately for us, India is always a hub for innovation. And some of these technology innovations like teleconsultation platform patient interface, counseling and care, which is available online, we really stepped up. And within no time, I would say maybe 30 days time or so, we were able to provide some of these solutions to most of the healthcare professionals across the country. At many places, our company has also gone out of the way to support a lot of government hospital for essentials, because the government setups and even many private setups, terms like PPE kit, masks, gloves, and we were not the indigenous manufacturer at that point in time. So there was a requirement of better licensing, better supply chain or contacts across the border to get some of these things in. And I think industry has done a fantastic job in terms of getting that provided to various government setup as well as that of private setup. And then slowly, as we learned about this whole thing, we did a lot of investment on our people in terms of getting them up and running for adopting the new technology revolution, which is happening because of COVID-19. In terms of how they interact with hospitals and doctors, in terms of how they provide a better care to various patients, because even now there is quite a restricted movement in many places, and people are afraid of moving to doctors and clinics and so on. And therefore, there was a requirement to provide a better technology interface, a better integrated approach to patient, wherein at one place they can get, not just consultation from a doctor, but maybe medication as well as diagnostics. So some of those solutions or platforms were provided by us so that doctors can provide best care to their patients. And now, as we move forward, I think the way I'm looking at the future, I think the integrated healthcare system, which has connected devices, what we call as digital therapeutics, may take a big, big move, especially in management of chronic disease, because those are the trends which are popular in West, and we see some merit there. COVID has taught us that India shouldn't be lagging behind that. We have been innovating all of this for developed nations now. It's time for us to adopt some of these digital connected devices for management of diabetes, high blood pressure, cholesterol, maybe neuropsychiatric disease and so on, because you don't require just a good drugs or medicines, you also require fantastic monitoring system which are remotely connected. So the remote management of patients, digital or connected devices, and I think as we are readying for 5G, so as soon as 5G is here, I think the entire Internet of medical devices, what we call, should become a very leading trend, may decide the outcomes for patients in chronic disease areas. So that's what we're looking ahead for future.
All right. Thanks for the comments, Sourabh. Of course, we have a network going of, digital health, of diagnostics, of imaging, of solutions coming forth. And that's something all of us are looking forward to. Kunal, want to come to you now and talk to you about Geto.org. Now, this is a crowdfunding platform. What changed in 2020 for you? Nobody was prepared for COVID, and we've heard of stories in Delhi where even well-connected people were having such hard time finding a bed for themselves during the peak of the crisis in end of June, and they were not able to cough up. Some hospitals were outright asking for big fat deposits to even give you a bed. If people couldn't cough up that money, right. Some people lost a lot of their family members. So there's a lot of pain and angst. What did you see in 2020?
Well, first, let me go back to how we started Geto and the reason that we started Geto. Geto was founded on the premise that what we were attempting to do was democratize capital, which means that we came across a lot of people that had great ideas, people that needed money for medical and social emergencies, but they didn't have access to any sort of capital. The other thing that we found was that there was a lot of people that wanted to help and a lot of people that needed help, but somehow these people weren't coming together. So the idea behind starting a crowdfunding platform was to sort of build a bridge using technology between people that can help and people that need help. And the power of that I've seen over the years, of course, but I've not seen the complete power of it like I saw during the pandemic. We've raised now about 140 crores only for corona-related fundraisers, which means medical equipment for doctors, making sure that the migrants can get back home, feeding stray animals, making sure that the underprivileged are getting ration. And what I've seen during this time is that a lot of people that have never contributed in their entire life have wanted to do something but have not gotten down to doing it, have come forward and contributed. I've started fundraisers. I have friends of mine that have not been involved in the social space in any way, but they've come forward and they've started fundraisers. And that's because I think each and every one of us was moved by what was happening, and each and every one of us wanted to make a difference. And I think for us, it became clear what Keto was doing. We were providing an avenue for goodness. In the past, if somebody wanted to make a difference, it would have been very difficult for them because they wouldn't have had even though they would have had the intent, they wouldn't have had the means to go about trying to make a difference. I think Keto gave them those means. I mean, I had a friend of mine who was watching the news with his daughter. She's just 10 years old. And they saw the migrant crisis happening. And she said, I don't want to just sit around and watch. I want to do something. And he called me up and he said that, can she start a fundraiser on your platform? I said, sure. So we set it up for her in about 45 minutes. And in 1 week, this 10-year-old girl had raised 14 lakh rupees for migrant workers to get back home. So in the past, if she had wanted to do something like this, it would have been impossible for her. She would have had the intent, but not the avenue. And I think crowdfunding provides the avenue for people to come together and help somebody. The other thing, like I was talking about, is the democratization of capital. We live in a world which is rapidly changing. Technology is affecting each and every sector, the medical and health space, of course. We're talking about robotic surgeries. We're talking about genome editing. We're talking about inserting nanoparticles in the blood that will give real-time updates. But the question is, how many people will actually have access to this technology? We live in a country where the health space is anyways underserved. It's estimated that about 200 million people have been pushed into poverty only because they couldn't pay their medical bills. We have a system where people have to sell their houses, take loans to pay for the most basic medical treatment. So how many people will have access to this technology? Not many, which is where we want to step in, and we've been stepping in to make sure that this capital gets democratized so that everybody has access to capital. And if you have access to capital, you have access to, taking care of your medical bills, you have access to helping your friends and family. And right now, we as a platform are only working in mostly the urban cities, but we start going to the smaller towns. We are hopefully looking at going to rural India soon, because we believe that until and unless the most underprivileged are helped, really, there's no point of technology if it's only going to serve the 1% of the population. It should really sort of reach out to each and every one that is underprivileged and needs help. So yeah, that's what is happening at our end. And also now in 2020, we realized that we have to, because we have now access and we've built a brand, we should also start developing other technology which can help a patient and doctor integration. So we're working on other technologies that are going to help doctors, help patients, and also help people connect with each other.
Digitally.
Digital, yeah.
All right. Thank you for your comments, Kunal. Definitely crowdfunding is, and the work done by Keto during this year is very noble and commendable. But we at IHW Council are asking, why should anyone have to pay for healthcare? The government of our country has already committed to universal healthcare. It is giving an insurance cover to nearly 50 crore people in our country. And we would like to think that technology is going to be an enabler to ensure that universal health coverage to everyone comes about. And, the government should serve us to at least cover our bills when it comes to our health. And till we get there, it's great that anyone who wants to help can do that by going on a crowd funding site, making a contribution, doing their bit as well. Geetha ma'am, going ahead, what kind of innovation can we see? Kunal has said, what is the point of having technology if it's going to serve that one person? Do you think technology is going to be constrained there? Because we are seeing technology changing a lot of things, like, the farmers are protesting now, but many farmers have apps that are helping them. They know the weather, they know the soil quality, they know they're adopting solar pumps. Many things are changing because technology is being adopted. Where do you see scale coming in for technology? And do you think it is not utopia that technology can be used for everyone?
Absolutely, technology can be used for everyone. I break the. The thing is, I also want to sort of give an example of how we have actually used it and how we can scale to several other diseases. So going back to this breast cancer screening using thermal imaging, because it's portable and so on, and also because it's automated, we said, okay, why only have high quality healthcare only to the urban paying hospital customers, and like Kunal was mentioning, why leave rural people around? In fact, that was one of the mission statements, Sarve Santu Niramai, let everyone be healthy, was the mission with which we started. So we actually went out, partnered with cancer societies, partnered with non-profit organizations to group people in the rural areas to conduct these camps. And in fact, we have a training program to make health workers, train them in 2 days to actually do cancer screening just using these software tools. And the way we had to do was also to make the automation much smarter and intelligent, because you cannot have a doctor reviewing every report when you're actually screening hundreds of people, and these people come from different villages, and once you lose track of where they are coming from, there was the first one of the cancer camps, right, and we knew that there is one Sharadamma who need to be tracked, and then we looked at the list. There were 3 Sharadammas, and after 1 week you go back and say which Sharadamma was it. We don't know any address or anything, because they just put the village name, and it's like crazy the way they write the list addresses, and many of them use their husband's mobile phones and so on and so forth. So with that, we decided we can enable the technology to do automated screening in real time, without any doctor, with just the use of health workers. And can it be done? Of course, initially, we used it as a pilot, and we were also reviewing and giving the report later. But yes, now we are at a stage where a health worker can be trained in 2 days to perform this test in the remotest of the villages, with or without internet connectivity, right? And then generate this report within 15 minutes, and then make sure that people who are likely to have an abnormality, group them together and bring them for further diagnostics inside a hospital. This is the triaging, or a red, yellow, green, the traffic light output, as you call it. It's a new product we developed, it was last year, 2019. So after seeing the need, and as well the possibility of using AI robo doctor for doing a provisional reporting, right? Of course, there are some fine-tuning of algorithms that need to be done so that we don't miss any cancer or likely cancer. So this is doable. Fast forward, I think we definitely can look at different diseases which require this early screening. In fact, all non-communicable diseases, early detection is absolutely critical to improve survival rates, treatment effectiveness, as well as reduce treatment costs. So we could look at different such possibilities and develop point-of-care devices enhanced with database decision making with smart machine learning algorithms to say, okay, can I provide these like center of excellences, like make the PHCs a center of excellence and a center point of early diagnosis or screening, right? So that people can come in and do the first level of screening there. And of course, push of a button, you can actually talk to a doctor if there is any doubt. Right? So coupling this with telehealth, which was talked about earlier, and point of care devices, I think it's a tremendous opportunity to provide high quality healthcare for everyone, every nook and corner of India, if I can go ahead and say that. And that's kind of, it's my dream, and I don't know whether it's going to happen like in my lifetime, but that is definitely a possibility using especially technologies like IoT and artificial intelligence, right? So this is feasible, and and it's been proven in multiple such occasions.
Right. This is very heartening to hear, and let's hope, ma'am, that your dream comes true, and we have more and more, parts of our country covered by this. Now, I actually would like to come to the government's plan, the National Digital Health Mission. Alok, let me come to you. Now, the government has a plan, and the Digital Health Mission is already underway, whereby every person will have health ID, a unique health ID. All of us have Aadhaar. So we have a health ID. We need a huge data infrastructure whereby the health records of each individual are stored centrally and are available to doctors, not just in government hospitals, but everywhere. This is a very ambitious plan. And even developed countries like the US do not have good success with storing patient records safely and in a way that's completely portable. This is what is being planned. How do you think this can work? And is it going to be the government's big umbrella, or are we going to see it as a public and a private partnership? Do you have a view on this?
Yeah, this is definitely a very ambitious project initiative. And you're right that even in the United States, where I live, interoperability is a major concern, right? So when patients have to go from one doctor to the other or one hospital to the other, the data, the medical records, they're not easily available. And any moment, there are number of integration touch points where data is moving from one place to another. Bad actors, they're always waiting, to grab your data. In fact, in healthcare alone, in the United States, data breaches cost as much as $4 billion every year, which is huge. It is much more than financial services and public sector. Now, coming back to National Digital Health Mission, it's very ambitious. Fundamentally, these IDs will empower patients, and especially those coming from villages and smaller towns. And it will make things very efficient for them, which eventually will help in cutting cost. Other aspect of NDHM is generating a lot of data. We heard about IoT, we heard about machine learning and AI. These are all data-hungry, technologies. So I'm hoping that the NDHM, the data that we collect, will allow government and other agencies to have targeted implementations of health plans. Not only that, it will also help in things like monitoring. For example, we have all heard about antibiotics abuse. So it's there, and a lot of unethical practices are very common. So it can also help monitor, are there abuses happening around medications? So this has many different benefits that we can achieve. And for companies like SeekMed, the telemedicine platforms, they can leverage this huge database and leverage the health IDs to provide a more seamless experience to these patients who are not, may not be educated, who may not have a lot of information. So it will save a lot of time. It will improve a lot of efficiencies. So I think it's a very welcome step. We'll have to see how the results come from these 6 pilot projects or pilot states, and how government can implement across the board. So I think more to come on that.
But Alok, just if we do a little bit of hypothesizing or crystal ball gazing, I want to try and understand that let's say in the future, the government has given each one of us a unique health ID. In that, once I'm a doctor and I put in that number, I will get the entire records. So if a doctor is on your platform, are you saying that once I give him my ID, he will have all the details, and then he will be in a better position to counsel me on what I should do?
Exactly. So what happens today is that every time a patient comes to us, a patient
you
has
take
to
a prescription and you first ask, how old are you? What is the problem?
Exactly.
Yeah.
And just imagine, in some cases, your history goes back many months, in some cases more, few years. So, and what if you miss, what if you don't have any particular medical record? So at least here, it will provide access to those medical records. It will save time. It will provide those clinicians, doctors, better opportunities to provide a better diagnosis, because you have all the records in a safe manner. and I'm hoping that technologies such as blockchain would be used to store this data, because the data volume is going to be so huge that you can't store these in a traditional ways of storing data. So that will provide further benefits around securing the data. Only the doctors who deal with those patients can access data, not anyone else. So, so I think there's a huge potential for this initiative.
Right. Saurabh, I want to come to you next only because, Alok has told us how to work as a patient. As a patient, when I access a portal like Saurabh's Seek Medicine, and I talk to a doctor, the doctor would already have all the records. Now, say this starts happening with everyone. You would have so much patient data. You would be able to then put an algorithm to figure out, say, in Uttar Pradesh, how many people are having diabetes, what is their diet, how much medicines is required in a particular state. And for drug companies like yours, you would know what to do. So how do the drug companies, access the data? Is there conversation going on that? Because yes, well, there may be privacy concerns. When all those in the ecosystem start using the data, we will have preventive care as well. You will start analyzing the data to make a prognosis of what lies ahead and how you should then move ahead. So what's in store for drug companies should this become a reality?
Anisha, I think rightly put that first and foremost, drug companies don't access patient level data. I think that's against the privacy laws and compliance, because yes, at a cohort level or non-identifiable data, obviously we can get access from various agencies who are working with patients. But as a pharmaceutical companies, we are not directly connecting with patients unless it is for education purpose. That's what is that's a regulation that we follow in India and maybe most of the parts of the world. The way we look at this entire national digital health mission is that one, it throws open a lot of data. Second, I think what you rightly picked up, it gives an avenue for predictive analytics, because today our epidemiology studies which are there in India are based on very anecdotal, small scale research which are conducted by few doctors or institutions, and we don't have a population level data for us to really know what disease pattern India is going to follow 10-year hence or 5-year hence, and what capabilities we need to have either at the pharmaceutical level or even at the healthcare professional level. So we are just fighting the odds as we get to know. However, if I have access to this data, what we're talking about through National Registry of NDHM, then we will have better predictive, and our research can be directed in that direction. Our drug development can be directed in that direction, and even our tech innovations that pharmaceutical companies are there can be directed in that side, because the entire ecosystem will be trained to work with that data available. However, the big piece, which, and I'll just like to continue from where Alok left, about how successful this initiative will be. It's not just infrastructural change, if you really ask me, wherein you put a system of having a national digital health record for every individual, but we're talking of a behavior change. It's not that once you have a portal or a system like Aadhaar available, you get access of data at any point in time. It's a huge behavior change, because for India and for all of us, health has never been a priority. I mean, you may have a record of your financial investment maybe for 10 years, a IT record for 20 years. For every property that you buy, you may have a record. But what you have seen for a doctor 2 months back or even a week back, you will not keep a prescription or record. So that's a behavior issue. I don't think that's about system availability. Having some form of storage and computer was available in India for a good 3 decades now. But it's a behavioral shift that one has to drive. When health becomes a priority right from a childhood, and if that behavior is inculcated, then the National Digital Health Mission will really be successful in its essence or spirit. Because while solutions, let's say today, Dr. Geetha talked about reaching to masses and identifying at a patient level what they need. But finally, the person should come to that camp or a campaign and be part of it. And once they are diagnosed with something, they should follow up and go to a doctor, keep their own things handy. But that priority suddenly vanishes the moment you get a treatment or the moment you start feeling well. So if the behavioral shift is managed well by not just government, but I think public at large, and every sect has a role to play. I mean, it has a role by government by putting a policy framework. It has a role by a lot of startups and innovators and health tech people, which we have in panel today, and population at large, how much importance we give to health, how much importance we give to, be conscious as much of what we are for education, as much we are for our financial security, as much we are for anything else in life. Are we so much conscious about health? And I think that in spirit will make the National Digital Health Mission successful in my view.
Right. Mr. Sibal, how do you view the National Digital Health Mission, and how do you think that companies like yours can also, be integrated into the National Digital Health Mission? And do you think that one of the things that patients have to deal with is the cost to treatment, especially imaging and things like that? So, do you think technology will also give us a way to perhaps reduce the cost of imaging and the procedures that require these medical devices?
Yeah, so National Health Digital Mission is a very ambitious program, as everyone has told. So my feeling is that to make it successful, as my previous speaker has told, that behavioral change is required. So a lot of things are required, and definitely with the help of this charge, and we will be able to find out the root cause of the problem, and and also give the solutions. So like some territory or some area, if the environment is not good or water is not good, so particular kind of diseases will come in those areas. Once we have the data, we can do a lot of mining of that data. Suppose people who are just sitting next to Ganga river, and there are a lot of pollution in Ganga coming, and those people are drinking that water. From that water, some waterborne diseases are coming. So we will be able to then repair those things at that point in time. Actual reason of those illnesses, we will be able to find out. Some pollution from big factories, some pollution from a nuclear power plant, the people who are living around. Because right now, we are just guessing, and everyone who is interested in his own thing, suppose I am interested to sell my medical equipment, I will just say, this is the best, please go for it. This is going to give you all the solution. So everybody has their own vested interest, and actual data will never come out actually, and it is a problem. Once those kind of things will happen, and this data can give us democratically, like which place demographically has a problem, what kind of problems are coming, and why those problems are coming. So it is more important to find out the root cause of the problem. We can send the medicines, we can sell x-ray machines, we can sell ventilators, anything. Those things are not material actually. They will come anyway. When the business is there, our companies are like vultures. They will go everywhere and sell those machines. But the thing is that to actually transform the health of the people will require a lot of, not only the systems, but definitely use of the data to find out the root cause of the problem and then repairing those things.
We have with us Dhaval Shah as well of PharmEasy. Dhaval, you would have been hearing what the experts have said. Now, we want to find out what are your expectations of the National Digital Health Mission, and how PharmEasy could perhaps, be integrated into this system, or how you can use, this unique health ID. How do you see this working out in the future?
Yeah, no, thank you so much for having me here. I think, yes, I've been listening, and I think very interesting thoughts. So if you ask me, I think for us, the health mission is extremely crucial. So for example, even today, right, we're looking at, there's nothing called as a digital prescription even today in India, right? For example, if a doctor writes a prescription, sends it to you over email or WhatsApp, it's actually, I mean, it's still gray whether it's a prescription, it's a valid prescription or not. Now that's something that's a simple ask, right? Wherein before, I think, see, the health mission will be split into multiple pieces. And as everybody rightly said, I think even a lot of developed countries have not been able to do it successfully. So it will be, great for us to also pace it out well. I think as step one, just digitization of records. So for example, even today, if a patient has ordered a medication on the PharmEasy platform, even 5 years down, we can tell you that what was the prescription that the patient used, who was the doctor who wrote it, what was the dosage, what was the date, etc., etc. But I think if this data is then recognized and fed into the system, which is just kept there right now, and where it can be leveraged and used later on, I think it will be great. So for example, I think the government is mulling unique IDs even for the COVID vaccine that is going to come out very soon, and that will be great, right? You don't want people to take like five different shots of vaccination at 5 different hospitals and then come back saying, hey, you know what, I got side effects. That's bound to happen. So I think for us, I think the push from our end would be step one, just recognize digital prescriptions. Today you can get a FIR on your email and it's a legitimate document, but you can't get a prescription on your email and it's not a valid document. Now I think that's the biggest pain point that we all need to solve for. Number two, supply chain digitization, right? So for example, we're trying to solve for healthcare problems in India. The basic premise that all of us, right, us, manufacturing companies, supply chain, the doctor experts, etc., are all trying to solve for is how can we give best care for the doctors, for the patients. Now, the simplest problem that we right now have is when I consume a single strip of medication, I don't know where it has come from. If you would have consumed, say, a ketchup in India, every FMCG product in India has a unique barcode. You can scan it, you'll come to know where was it manufactured, date, etc., etc. On pharma, there has been no barcoding made mandatory. And that's been because of the function of the industry. A lot of contract manufacturing margins are wafer thin. People don't want to spend. But if you want to export the same medication, you need barcode. Now, if barcoding is made mandatory right at the source, a lot of issues around availability, affordability can really be addressed. Authenticity can be addressed because it's just digitally enabled. Simple things like digital prescription, digital barcodes and products, I think this will go a long way in shaping up the way we all think about digital healthcare solutions or, national health mission. I think we are obviously still far away from having multiple doctors look at the same report, advise, then it goes to their pharmacy. Yes, it will happen over the next 3 to 5 years. But I think as next steps or first steps, I would rather say these basic things would really go a long way in solving for a lot of issues that we currently have.
All right, so we've already seen, Dhaval, that the government changed a few things quite quickly as soon as the COVID pandemic struck, and let's hope some of these speed breakers would also be gone sooner than later. Kunal, what are your expectations of the National Digital Health Mission? Crowdfunding is giving hope to people, especially when it comes to chronic or difficult diseases, to be able to raise funds, etc. For routine healthcare, for diabetes, for cardiovascular issues, if you have a database and if you have regular follow-ups which are easy, perhaps you would have some sort of prevention rather than just treatment coming in. What are your expectations of the National Digital Health Mission? Kunal, I request you to unmute yourself.
I think everybody's pretty much said what is to be said. I think we've pretty much covered everything. What I can tell you is from our perspective, from a perspective of Keto, crowdfunding platform, I think it's very important that the government also works very closely with private players. I think that's really essential because there's some things that the private players can do which are far more efficient and effective because we're dealing with such a large quantum of a challenge, right? To give you an example, we started a campaign called Milkar with the government of Maharashtra. And what we found during the pandemic was that there were some areas where all the NGOs were getting donations, were getting contributions. But then there were other areas that were completely underserved. So for instance, there were a lot of NGOs working in Dharavi, and people felt like, Dharavi needs the most amount of contribution. So a lot of the contributions were going to all the NGOs that were working in Dharavi, the result of which was that the same household was getting food packages from 3-4 different NGOs, whereas there were other areas that were not getting food packages at all. So we tied up with the government of Maharashtra and the BMC and corporates. The idea was to build a technology solution on our platform. So what we built was a map of Bombay. And that map of Bombay was updated every day by the updates that we got from the BMC. So the BMC would tell us that this is the area that needs the most help at this point of time. So as soon as you went onto that map and you clicked into the area that needs the most help today, it would tell you all the NGOs that are working in that particular area. So once you went into that, you could select the NGOs that were working there and specifically contribute to them because you knew that that was the need of the day. We also had tied up with corporates. So the corporates were matching every rupee that was donated with another rupee of their own. So I thought it was a very sort of seamless integration of the government, the BMC, platform like Keto, corporates, and obviously individuals that were donating. And I think we need to see a lot more of that. I think there has to be a lot more integration with the private player. And I think that is something that can be very, very effective.
All right. So you've already shown us how it works when the government, the NGOs, the private sector all work together, and the digital health mission will perhaps be a success then. There are a few concerns about Alok. Some of the things which a lot of naysayers always come up with, about privacy, about data, because patient health records are sensitive, and in this year itself we have seen a number of pharma companies, drug companies, healthcare companies who have faced data breaches, which you yourself mentioned, which has cost money. And so do you think that some of these concerns are a little overrated, or are they justified? Because in our country, as of now, we don't have very strong data privacy laws. What is the way out? We don't have the infrastructure to reach everyone. We need to get to a platform that will leverage technology so that solutions and healthcare is available to many people. At the same time, you're worried, will my data be misused? Because see, I go to policy the website to search the price of a health insurance policy. I take one, but 10 more will call me and say, do you need health insurance? So, it's okay, they're calling me for health insurance, but tomorrow they may use my data somewhere else. So, in a country where our data privacy laws aren't very, strong, should there be a worry, or do you think even that will fall into place because the government is working there too?
Very good question, Anisha. We must worry. And I think we all know that technology always leads regulations. So regulations, there's always lag there. But as India establishes itself as a leading medical tourism destination, we should not just be looking at patients who come from India, but also from all the international countries, especially developed countries. So it is incumbent on technology leaders to follow those global standards, which come in the form of HIPAA compliance in US, or GDPR in UK, or PIPEDA in Canada. I know in India, Disha Act is under review. So I'm hoping that that would be passed soon. So that should provide more clarity. See, from business point of view, I could have the most robust and most secure company in the world, but then it would be very difficult to do business with. So it's finding a balance between flexibility and providing security. Now, a common man from a small village or town will not understand the meaning of data privacy. But then when we set our standards, we should not be looking at that as a benchmark. We should be looking at meeting what those global standards are, right? And why wait for government to decide or tell us, about regulations? We know what those regulations or what those guidelines should be, right? So I think it's upon us, for technology leaders, to take a step and stay ahead of the curve, because the cost of not doing that is huge.
And Dhaval, like Alok said, that it's upon us to take proactive steps. Our own companies will take those proactive steps when they export or they interact with companies based in the UK, because there the laws are strict. So why aren't they doing it here right now? What are they waiting for? The law?
So, see, I mean, see, we can all debate on this till, we end this debate. But I'll tell you, see, in India, we've had issues that plague us, which are maybe need more priority than maybe data privacy. I'm not saying it's not important, but for example, just availability of TB medicines, right? I mean, this should have been solved like 10 years back. I mean, we shouldn't be having issues which are unheard in other countries. I mean, I would be okay, and again, this may sound politically, but I would be okay if my data breaches happen, but every Indian in the country gets medicines at affordable cost that they need. I mean, if you're able to prioritize availability, affordability over everything else, I mean, I think that's what even the government obviously is trying to solve for, right? I think you have to balance it. See, for example, as I said, right, your barcoding is a simple solution, but it adds to your cost. That adds to your availability and affordability in the country. So we'll have to innovate in ways which is very well suited to our nation. So, for example, HIPAA compliance, as Alok absolutely mentioned, but I think, uh, I mean, see, HIPAA is again a self-regulated modality. It will take us 5 to 7 years to actually come up with our own HIPAA standards. It's tough. In a country where 99% of prescriptions are handwritten, having a digital backbone is very, very difficult. But we can take steps which can drive us to those end outcomes, which can be, as I said, um, ensuring that there is visibility, track and trace, just ensuring that people do not abuse the system. I think small checks and balances can go a long way. But yeah, I think I'm sure the regulators are looking into it, and we should expect something soon.
Geetha ma'am, where do you see this? Do you think that too much emphasis on privacy is like missing the wood for the trees in a country that's starved of healthcare, and it is so underserved? What do you think?
Yeah, I think I agree with all of the panelists' opinion on this, and it is a very complex subject, and particularly when you're trying to sort of balance availability and accessibility with privacy. One can decide which side is compromisable. Having said that, it is not very difficult to put light regulatory framework in place, because what are we talking about? We're talking about a platform, right, where every hospital may actually sort of put in some kind of data. They've already sort of trying to define the protocols, having a POC of it and so on. So at the time of entry, sort of just have some kind of a gatekeeper, if you will, right? One time, when you register a hospital, which is contributing data to it, you have one gate, certification, right? Saying that this is what's called as ISO 13485, which is a well-defined regulation, which says that whoever is doing what they're doing, they know what they're doing, especially if it's a healthcare system. So a small startup like us, Niramai, which is just 3-year-old with 50 people, we are going for an ISO. We have almost done with ISO 13485. And after that, I can tell you that if anyone is serious in doing healthcare business, they better be conformant to ISO 13485. Otherwise, you're not being sort of, you can't take things for granted. Things very simply, because you are playing with end user data. It could be as simple as providing the right kind of medicine to that person. Forget about the privacy angle, right? So once you have that framework in place, maybe all you have to say is only companies who are ISO 13485 compliant can come in. Plus, here are the 3-4 ways in which we would like to check one additional SOP, standard operating procedure, which ensures that your sharing of data, follows. There are certain things that whenever you share data with anybody else, like you would have an outsourcing process, have a sharing process or whatever, there may be some nicer names for it, right? And then see, this is the one extra SOP that I'll need beyond your ISO 13485. It's not just for adding data in, it's also about taking data out. That I think is definitely doable. I mean, we should not ignore that. Like saying availability is more important. In my opinion, it is possible to put this small regulatory piece in picture. The second piece is also, I'm very excited when, Sourabh and Mr. Sibal was talking about use of data there. It's not just about, all the data is in one place and the patient can access. There's humongous opportunity with the AI and data analysis that one can do to enable better healthcare outcomes itself, right? For example, I know a company, what they're doing is to just look at what are the different prescriptions the doctor has for these kinds of symptoms, the same symptoms, what was their earlier prescription. So almost they give you a checkbox saying, okay, this is the medicine you gave 1 month ago, this is the medicine you gave for the same doctor, because he tends to do, and then say, okay, decide. So it can also help in treatment planning and making sure that there are no mistakes done, because everything is human error at the end of the day. So the overall quality of healthcare delivery itself can be humongously improved as well. So I think we need to look at the data analysis and artificial intelligence based analysis that you would do for predictive, and you can give many things, say that you are due for a screening right now because 1 year old screening is what you had, and so on and so forth, right? So it also helps in keeping the overall health of the ecosystem itself very, very nicely. So I think it is possible to put some small policing, and you shouldn't lose that, but it's an excellent step that government has taken.
Right. Saurabh, you were smiling listening to the speakers.
I think,
what would you want to say? Because Geetha ma'am has said nobody should be in the business if you're not serious about patient privacy. So you don't have to conform to what's in Europe, but at least have minimum standards.
I mean, I was smiling for the fact that, we at certain occasion, we are so sensitive about privacy. And at certain occasion, we just give away privacy for free. So what happens is it's very subjective, and at times it becomes political discussion instead of a real concern for privacy. I mean, I'm just wondering, when you're giving example of, you searching for an insurer, and suddenly while you're searching for one, you get a call from 5 guys. In a way, if you're able to get a better product, okay, has it really impacted your privacy, or has it able to help you get a better solution? I think that's the trade-off one has to really work for. And I'm not subscribing to the view that there shouldn't be a strong privacy law, but at the same time, it should not be overhyped. I mean, one has to really understand that there is a journey which the country is going through. I mean, this is not going to happen overnight. There will be hackers, there will be breaches, but let's look at the bottom line. I mean, in a way, if we are able to serve a population well, if we are able to get things to the place where we want to, I mean, one has to live with all of this. I mean, 2 days back, we got to know that Google had a trouble with their whole system, right? There are 3 Indian companies got hacking in last 1.5 months. What does it mean? Does it mean that you should only have firewalls and you should just keep strengthening? Not that you should not work on IT security, but at an overall level, if the impact is not very significant and if it is manageable, one has to keep moving on. In fact, instead of really putting a lot of barriers and being too much worried about, because even when you're talking of NDA, HM, the digital record and registry for all the patients, we may encounter this as we go forward. We will have issues. When I was hearing Dhaval talking about barcoding and all, will the industry come forward? Industry will come forward for sure. People are willing to do it, but does it mean that we will not have any counterfeit? I don't think we would be ever be able to claim that. So we will have counterfeit despite of having barcodes. We will have issues of supply chain still, despite of having known the last mile happening or not. One has to be ready for the change. I mean, that's the whole point. And when I was talking about all of these changes, it will have some cost. But net of it, you'll have to figure out, does it benefit population? Does it benefit those who are otherwise not getting access to the system? Say today, if Dr. Geetha is able to reach to the rural population where breast cancer was not diagnosed, and by that effort, if she is able to identify 10 women and able to provide them good health care, I mean, I think that's the end point. No, we are looking at a better outcome. I think that it need to be balanced. Not that again I'm subscribing to that there shouldn't be privacy loss, but at the end, look at the end point. I mean, if it is serving population at large, it helps. I was on my laptop and suddenly it conked off. I had to switch. Now, can I expect that things will be all smooth all the time? It doesn't happen. I mean, you'll have to have option 2 ready, and I had to keep my phone handy, logged in through that, and I'm in again. So, and I think in our journey towards digitalization, these things will keep happening, and one has to be ready to accommodate and adjust to it all the time.
Right. Mr. Sibal, in the future, how do you foresee a company like yours working to innovate quickly to the need of the hour? Say, you have digital records of patients and you use analytics to figure out that going ahead, perhaps this disease is going to increase here. So we should deploy these kind of imaging or these kind of devices in this particular area. Could you use data to innovate quickly and hence move quickly? Where do you see this entire digital backbone taking us and changing the face of delivery? Will it also improve quality of delivery?
Yeah, surely. Actually, first and foremost is digitization is going to give us the democratization of the things that services can reach to those people very, very fast. We will be able to diagnose those problems. We will be able to connect them to the right kind of a doctors. So that is very, very important. And for innovating also, for AI to become more and more smarter, we require more data. So uh, the thing is that data security, the concern which everybody has told, and my feeling is that data belongs to the patient, and which rightly said by the government also, and Dr. Indu Bhushan, I was reading his article, and he told very clearly this data is basically for the patient, and it is not a property of a hospital or any diagnostic center or any company, whosoever is making equipments or anything. So basically it is his data, and it is up to him. He can give his passcode to anyone, password to any doctor. Suppose he's going to Apollo Hospital, then Max Hospital, or any other hospital, and he can give his password, and then the doctor can enter and see his records. So we have to keep it simple, and also anonymizing of the data. Like when we need a data, we don't need the name of the person, name of the patient. We only need a complete data from which we can take out the reports, and our computers can think that what kind of a disease are there, and then they can develop the faster thing. So it will definitely help us to get more data, access to the data, but it will all depend upon the policies of the that how government wants to share those data and what are those policies. Because there will be many people who will be saying why you're providing this data to companies, but if you will not provide to the companies, companies will not be able to work on the data. So it will all depend upon the kind of a trust factor which is there. So there has to be some trade-off between that. Security has to be there. Definitely data security is important, but after anonymizing of the data, when the name and everything is gone, then you will not be able to know whose data is this, and then the companies can utilize those data. So those are the simple things which we can do and move forward.
Right. Kunal, you said that Keto is a platform that provides capital for those who need it. Now, are you also, funding innovation or simple solutions to complicated health problems? What are you foreseeing going ahead? How will your platform help to make healthcare services perhaps more reachable for people?
Well, first and foremost, like I said earlier, is as a platform, what we do is just connect the buyer and the seller. That's what we do as a platform. How much innovation happens on Keto really depends on how innovative somebody that's starting a fundraiser is. It's really not dependent on us. What we found is that most of the campaigns that are funded on Keto are medical campaigns, usually because when you have a medical need, it's urgent and it's a matter of life and death. That's when you're likely to see a lot of people come together to support you. You might have a product that you want to launch in 8 months, 9 months, but that might not feel like an urgent need to somebody that wants to donate. So that really then comes down to how innovative the product is. So I think if we want to see innovation, if we want to fund innovation, first we have to encourage innovation. I think that's really important. I think it's very important to encourage entrepreneurs that are doing something that is very, very innovative. I mean, we found it that a lot of products on our platform, health products, have been funded, but they've been funded. So it's a really sort of strange mechanism. We had a couple of people that came on the platform that wanted to start something that was very innovative in health. They reached out to investors and they got no response from them. Then they came onto a platform like Keto and started crowdfunding fundraiser. People reached out to them, donated to their fundraiser. Once they raised that money, they actually found a lot of investors coming to them. And that was because the investors then had a proof of concept. The investors then found that people were actually interested in the product. So I think it's a bit of a innovation first has to be encouraged before we see capital flowing towards that innovation. And I think that's something that the government has to do, is to come up with the areas, identify areas where this sort of innovation can happen and can be encouraged.
Right. So
also going back to what everybody's been saying about data is that, I'd love to ask everybody, where does sort of data breach end and where does, it begin? Because today we live in a world where you have health trackers, you have apps that have all your information, you have, women have pregnancy apps which monitor everything, all their periods, their sexual activity. You have different kind of apps that's already monitoring everything that you're doing. So who sort of defines what data is accessible and not accessible, and what is sacrosanct and what is not sacrosanct? So how do we sort of identify that? I think that's something only the government can do. Otherwise we're
and
already.
We also.
I mean,
we will also have that choice, right? We should also have that choice.
No, but I'm saying somebody has to sort of define what that is, because when we're talking about privacy, I think our privacy is already, in the hands of a lot of apps now, and it's already being used. So where does that sort of, who defines what is okay to access and not access? We can't do that as individuals maybe, but maybe the government can.
All right. So at close, I'm going to take one parting shot from each one of you on what you want to see going ahead and how technology will change things. Alok, I'll start with you. One liner on what are you most looking forward to?
I'm looking at technology, as I stated in the beginning, to build trust. As most of our countrymen live in small villages and towns. So if we can reach that barrier, I think then technology can really reach its potential, true potential. So, and with things like language barriers and other things. So I think that's something that I'm looking forward to from technology point of view.
Sourabh, one thing that you're looking for that technology will change in the future?
I think I'm looking at better partnership between public and private, because I feel there is a phenomenal potential. And second, technology with ease of what maybe something like WhatsApp offers to everyone, wherein it can actually reach to the last person who deserves it, so that all the benefit what we're talking about don't get restricted to the top 1%, what Kunal was talking about, but it actually reaches the masses. So partnership of public and private, and simplicity in technology which is accessible to everyone. That's what I'm looking forward to.
Geetha ma'am, what are you looking forward to in the future? That one thing that you wish for that technology will solve?
Yeah, it's bridging the healthcare divide that is there for high quality healthcare in the rural and this, using technologies which are self-diagnosing, right? Which are able to do some kind of automated diagnosis at the corners of India.
Dhaval, your wish list, that one thing that you want in the future and technology will make it happen?
No, I think just availability of healthcare. I think in a country like India, I think that's extremely crucial over everything else. I think it's just making doctors, medication, healthcare services available at the right time, at the right price. I think that's what I'm looking for.
Mr. Sibal, what are you looking forward to? That one thing.
I'm looking at the democratization of the healthcare and accessibility of the healthcare to everyone at a very, very low price. And technology is going to do that.
All right. Kunal, that one thing that you were looking for?
Well, I think two things. One is connection and the other is equality. I think when I talk about connection, people being connected to each other, doctors being connected to patients, patients being connected to capital. So I think connection is really important. The other is equalization, which I already see technology doing. I mean, today, earlier education was accessible, say, to very few people, high degree of education. Now you could be sitting in a small town or a village and you could be on your smartphone and you could access information that's accessible to anybody anywhere in the world. So I think technology is already playing its part in connection and equalization. I hope to see a lot more of that.
All right. A big thank you to all our panelists for joining us today and discussing with us how technology can be used to leverage healthcare solutions and to improve access for everyone. In the future, we hope, we'll see a lot more of good quality healthcare going to all those who deserve it. And it will be technology that will that'll be the enabler to make this happen. Thank you, Alok. Thank you, Geetha ma'am. Thank you, Kunal. Thank you, Sourabh. Thank you, Mr. Sibal. And we want to thank Dhaval as well. He's had to drop off. But thank you all for joining us.